Well, it's taken a while to get there, but Republican leaders in the state Senate say they are now ready to expand Medicaid.
Now, it would mean around 600,000 North Carolinians would be insured, and that's something both doctors and patients feel is needed.
On the outside, everything looks as happy as the smiles in the photos, and there is happiness, but also great worry. Dana Bango works part-time so she can care full-time for her father, who has cancer, and for her mom, who has pancreatic cancer and stage 5 dementia. And Dana has also been diagnosed with cancer.
It's just a little scary going into this not knowing how much debt I'm going to come out of this with.
Debt because Dana doesn't qualify for Medicaid and can't afford private insurance.
I just got to be practical. And I just keep planning ahead, and I don't know. I just figure I'll get through it. Then I'll worry about it day by day.
A bright spirit, but a struggle seen too often by doctors like Lawrence Greenblatt.
We spend more on healthcare than any other country in the world, and yet, we still have people who really don't have access to basic services. And I think that's really unacceptable.
Dr. Greenblatt works with Duke Health and is the medical director of Northern Piedmont Community Care's Medicaid network. He says we're already paying taxes for the federal program that would pay for 90% of the cost to expand Medicaid in North Carolina.
So why allow our money to go to other states to provide medical services? We need it here. We have so many folks who would benefit from this. Their physical health would be better. Their mental health would be better. Our state economy would be improved. Our health systems would be shored up. This is just the right thing to do.
He adds it would also help keep rural hospitals open, get prescriptions to those who need it, and help alleviate crowded emergency rooms.
There are plenty of folks who end up in our very crowded emergency rooms with health problems that could have been treated elsewhere or could have been prevented had they had access to regular primary care or specialty care, which is the kind of thing Medicaid would fund.
Including allowing Dana to get the cancer treatment that she needs.
I think it'll be good for everybody, not just me, to get Medicaid expansion.
It's sad to think that she has to worry about the amount of debt that she's going to have through all of this.
Exactly. I mean, she works part-time because she's full-time caring for her parents, and she has her daughter who's 17 years old.
Wow.
So in the state of North Carolina, we are one of 12 states in the whole country that have not at this point expanded Medicaid since the passage of the Affordable Care Act. There are still two sides on this. Not everyone is on board. Michael Hyland has been doing a lot of reporting on this. We'll have more from him at 6. And we have lots of coverage at CBS17.com as well.
All right, Russ, thanks.